Hello, listeners. You're welcome to the maiden edition of Advocating for Specially Abled Children here on Amogate Radio Communications. My name is Oluwaseyi Obasa, and I am a special needs therapist and advocate. This program is fully enriched to address issues that concern developmental disabilities as it affects children of different ages, challenges, and status. I beckon to all caregivers, teachers, mothers, fathers, siblings of children in this category, head teachers, head of schools, to please tune in as we'll be delving into series of disabilities, their possible causes, how to identify them, possible measures on handling these children, and how to avoid further occurrence in couples looking forward to having children. Specially abled children are children also known as children with developmental disabilities. These children who experience significant changes or challenges in their cognitive, physical, emotional, or social development. These developments can affect their cognitive functions, which is learning, reasoning, and problem solving. Their physical abilities, that's mobility, coordination, and sensation. Their communication skills and their hearing. Their emotional regulation, that is their behaviors, their mood swings, and their mental health. Their social interaction with people, their relationships, empathy, and social skills. Some common developmental disabilities are autism spectrum disorder, Down syndrome, cerebral palsy, intellectual disabilities, ADHD, that is attention deficit hyperactivity disorder, learning disabilities like dyslexia, dysgraphia, dyscalculia, and but to mention a few, sensory processing disorder, Fragile X syndrome, Rett syndrome, neurodevelopmental disabilities, and many more. Some characteristics that these children exhibit are delay or difficulty in achieving milestones, difficulty with self-care and daily living skills, limited social interaction and communication, emotional regulation challenges, physical limitations or mobility issues, learning difficulties and intellectual impairment, social challenges, social behavioral challenges. What kind of support or how do we accommodate children in this category? Usually I advocate for early intervention. Which early intervention helps to reduce to a minimal the effect of these challenges in the children. We also ask that they have an individualized educational program which helps to support their learning abilities. So for some of them that have been diagnosed, or some of them that these milestones have been noticed, delayed speech, mobility issues, we always recommend that they have a speech therapist or an occupational therapist as it may need, and a physical educational therapist. Medical interventions too can help for some of them that might need medical management, behavioral interventions for those that have that need a bit of behavioral modification, social skill training, which can be given by a behavioral therapist, and family support, which is very important. Every child that has this challenge need their family to understand and support them lovingly. Okay, so to begin with, we'll touch down on some of these earlier mentioned disabilities. But before we do that, I'd like us to understand that most of these challenges are neurologically inclined, as it affects the nervous system, including the brain, the spinal cord, and the nerves. There are different types of neurological disorders, and some of them, I will just mention a bit of them, and then we'll later, probably in the next edition, start picking into some of these neurological disorders. Okay, so first off is Alzheimer's disease. Alzheimer's disease is a progressive memory loss and cognitive decline. So it affects the thinking, it affects the thought process. It declines it, and this is basically found in adults from the age of 65. But in rare cases, we find that children and young adults can develop Alzheimer's if it comes with related disorders. Okay, so another of it is neuropathy. Neuropathy is a damage or dysfunction of the nervous system affecting various nervous types. This can cause numbness or tingling, weakness in the muscles, or what we call muscle wasting, sensitivity to touch, difficulty walking or balancing, digestive problems, urinary issues, and abnormal heart rate. Another of it is cerebral palsy. Cerebral palsy is a neurological disorder affecting movement, muscle tones, and coordination. And then we have the autism spectrum disorder, ASD, which is also a neurodevelopmental disorder which affects communication and behavior. It affects the speech, communication, and behavior of a child or an adult, as it may be. There is the attention deficit hyperactivity disorder, which is also a neurodevelopmental disorder characterized in three categories. The first category is the inattentive category. You have children that are in the inattentive category have difficulty sustaining focus. They are disorganized, they are forgetful. And then we have the second category, which is the hyperactivity. The children that are in this category are restless, fidgeting, they have excessive movement, and they tend to talk a lot. We call it talkativeness. Then the third category is the impulsivity. Children in this category or adults in this category make impulsive decisions. They tend to interrupt people, especially when they talk or trying to get attention, and then they have difficulty taking turns, waiting for their own turn. And just to mention a few. So there are many other neuro disorders, some of which we'll be looking into as we proceed in the program, in as much as we'll be looking into neuro disorders would also be taking a ride down the intellectual, physical, and learning disabilities. Okay. Today we'll be looking at attention deficit hyperactivity disorder briefly. Okay, so this is a chronic condition that affects millions of children and often continues into adulthood. It's a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulsive behaviors. Children with ADHD may also struggle with low self-esteem, troubled relationships, and poor performance in school. Some of the symptoms that children in this category have are because they are differently, they are categorized in three different categories. That's the predominantly inattentive category, the predominantly hyperactive or impulsive category, and then a combination of both predominantly inattentive and impulsive. Okay. For the inattentive children, you will find out that they have these patterns. It might not be everything, but you will see that there are some of these patterns that you will see as a constant, as a repetition or as a constant in them. One, they fail to pay close attention to details, or they make careless mistakes in their schoolwork. So these are some of the symptoms that you will notice in these children. Please take note. 2, they have trouble staying focused on task or in play. They appear to listen even when spoken to, or they appear not to listen. They appear not to listen to even when spoken to directly. They have difficulty following through on instruction and fail to finish schoolwork or chores. They have trouble organizing tasks and activities. They avoid or dislike tasks. Okay, so before I became a special needs therapist, I had these issues with my last child, and it was unbecoming for me. It got to a point I was even thinking it was a spiritual case, until I stumbled on some article and I started reading. And then I had to take him out to a pediatric developmental doctor. And he got this diagnosis of having attention deficit hyperactivity disorder. And then this was my encouragement to study on being a therapist, so that I wanted to know more. So I had to go on this study, on this journey to becoming a certified special needs therapist. So I observed these things in my child. I observed that he was restless. I observed that he was inattentive. But despite that he was inattentive, he was extremely brilliant. It didn't seem like he was listening in class, But then you would hear him talk to himself and mumble out the things that had been said in class. He would keep repeating them. I found out that he was not able to stay in school, because at that time I was also a teacher in the school. And I will find out that he was never in class. He would leave his class and go somewhere else, even without the teacher noticing. Sometimes he could even be under the table, but he was listening. He was listening, but he wasn't directly listening. I also found out that my son was so restless. He was too restless. He couldn't stay on a task. He couldn't focus. He was having difficulty following through instruction, and he wasn't participating in written work in class. My son was not organized. Oh my God, he was never organized. His things were flung everywhere, littered. They don't like tasks. They don't like instruction. They don't like to focus on they don't want to make any mental effort. So their homework is always a challenge for them. They lose items, they forget. He was always forgetting his things. Mommy, I'm sorry, I left my pencil in school. Mommy, I'm sorry, I left my book in school, my homework book. At a point, I was thinking he was being intentional about it, that he was not wanting to, but it was just, it was later I found out that it was a characteristic, and he was easily distracted. Every sound was a distraction for him. So these are some of the challenges you find with children that are inattentive in class. We also have the hyperactive and impulsive. So my son falls into the category of the inattentive and the hyperactive rather. So we have those with the hyperactive and impulsive characteristics. They fidget with, or they tap their hands and legs and feet, they also have difficulty sitting, being attentive in class. They have difficulty sitting. They are constantly on motion. They are on motion. So you can't get them to sit in one place, They run around, they climb inappropriately. They have trouble playing or doing activities quietly. They talk too much. Like I said earlier, they have this talkative attribute. The blot out answers, interrupting the questionnaire. So because of their impulsiveness, they tend to think ahead of the questionnaire, and they just blot out their answers. They interrupt and intrude conversations, games, and activities. Children in the third category have a combination of both. Children in the third category, and the third category is the inattentive and the impulsive category. So they have a combination of both the inattentive and the impulsive. So these children have problem in class, but they get along well at home and with friends. They get along well at home, very well. What are the causes or possible causes or risk factors? ADHD does not have an exact cause. There is no known cause for ADHD, but we have some factors that may be involved in the development of ADHD, and some of these are genetic. It could be the environmental problems, or problems with their central nervous system at key moments in their development. Some of the risk factors are blood related, such as parents and siblings with ADHD, exposure to environmental toxins such as lead found in paints, pipes, and other building materials. Maternal drug use. So parents that use drugs, unprescribed drugs during pregnancy are at a high risk of having children with ADHD. Overuse of alcohol and smoking. Smoking can also be a risk factor. Also, we have premature birth. Yes, children with premature birth are at a high risk of having attention deficit hyperactivity disorder. Sugar has also been known worldwide, or has been speculated to have been a popular suspect of causing hyperactivity, but medically there is no proof at the moment. But we also try as much as possible to advise parents to go low on sugar, although not proven, and also to avoid processed food for the children in this category. Many issues in childhood can lead to difficulty sustaining attention, but that's not the same as ADHD. So sometimes they have some similar symptoms or attributes, but they are not ADHD. ADHD can make life very difficult for children. Often they struggle in the class, which can lead to academic failure and judgment by other people, both children and adults. They tend to have more accidents and injuries of any kind than other children who do not have ADHD, because they are impulsive and they are hyperactive. There is always this tendency they have more injuries. Children with ADHD battle with poor self-esteem. They battle a lot with poor self-esteem. I remember my son coming home to tell me, "Mommy, you don't love me." And I told him, I said, I love you so much. What makes you think I don't love you? You give Demilade more attention than you give me. And I'm like, no, I love you the same way. So they have poor self-esteem. They battle with it. They are more likely to have trouble interacting and being accepted by their peers. They are at increased risk of alcohol and drug usage of substances. So some of the coexisting conditions, we call it comorbidity, are with attention deficit hyperactivity disorder, are ODD, oppositional defiant disorder, conduct disorder, disrepute mood dysregulation disorder, learning disabilities, substance use disorder, anxiety disorder, mood disorder, autism spectrum disorder, and Tourette syndrome or tic disorder. So how do we prevent ADHD? During pregnancy, we advocate that mothers should avoid anything that harms fetal development, drinks, drugs, cigarettes. They should avoid. They should protect the child from exposure to pollutants, toxins, and they should also limit screen time. Although still unproven, it may be prudent to children to avoid. It's prudent for children to avoid excessive exposure to TV and video games for about the first 5 years in their growing. Okay, so in our next edition, we'll be looking at, we'll be journeying down the lane as we visit some learning disabilities. So before then, I hope that you have been able to achieve a lot from this very short but very precise teaching. See you next edition and have a lovely